Hi, my name is Suffia Alvi. I'm a fourth-year medical student at the University of Illinois Chicago. I'm with Dr. Chirag Shah, chiropractor and a patient at the ENT department here at U Chicago. He has undergone extensive surgeries in this department, and I just wanted to bring him on and talk about his experience. I first wanted to thank you for joining me and sharing your story with all of us here today. It just really means a lot that you're willing to be vulnerable and open, and hopefully can help pay it forward to other patients as well. So, Dr. Chirag Shah, do you mind just telling us a little bit about your diagnosis and how it sort of came about?
Sure. I was diagnosed of needing a triple bypass in 2021, May. After that surgery, I came out, which I thought was a lesion in my mouth. The lesion in my mouth, while recovering from my triple bypass, the lesion in my mouth got bigger, and I developed 6 root canals in 5 months. But never realizing that it could be anything but cancer. Kept on seeing a dentist, and we kept on putting in root canals while the pain in the corner of my mouth got worse and worse. And so did the lesion, which got, the lesion turned to lycoplanus, and the lycoplanus turned to an oral cancer. That whole time frame was about 18 months. Also, after my triple bypass to October of 2022, I had lost over 40 pounds. At one time, I weighed 215 pounds before my open heart surgery. Today, I weigh 167. Before the October surgery, I was at 180. So the weight loss continued, and that should have given somebody some inkling of what's going on or want to investigate it.
Can you tell us a little bit about what surgeries and treatment you went through?
Yeah, so my first surgery was October 7th of 2022, where they did a free flap, took out the lesion and replaced it with the skin off my forearm with a new artery connected for blood supply. At which point we thought that would solve all the issues, and also they had taken all my 43 lymph nodes out. After that, we started radiation in December, I think. While I was going through radiation, I developed several infections where I had to go back into surgeries to have it drained, sliced, and also patched up again. That kept on continuing because out of the radiation, I ended up getting osteonecrosis. Because while the first surgery was done, the mandible had cracked, so they had put a metal plate in there which got infected as well. So there's a lot of infections that took place after the radiation, and I had 2 weeks of radiation and 4 weeks of proton therapy. We don't know quite well how the two reacted on my skin and my surgery, but it definitely made the bone more necrotic. So my latest surgery was on September 7th, where they had to replace the mandible. They took out several more teeth, replaced it with a fibula, reshaped my mandible, and also UFC is the only hospital around here who does this, put in the post so I can have implants put in later on in the future, so I'll have a full set of teeth again so I can eat instead of taking it to my G tube right now, which I take all my nutrition through and my medication through. And because of trismus, I really can't eat anything through the mouth as much. So from that, they also took some skin out of my thigh to patch up the fibula, wound site, and they put a new flap on the outside of my chin, so the skin will heal better, again because of radiation, which had done damage to my skin.
I just wanted to ask how you felt when you were first diagnosed, what sort of went through your mind.
Well, the thought process are the usuals, anger, sad, the why me's, but mostly angry at the world. I practiced for 33 years helping others, and you have the why me complex.
What has helped you work through that?
Counseling has been big at Living Well. Talking to others, explaining them my journey. So the love and the support and the counseling is very big, otherwise it'll take you into a dark place. And going into dark places, you really need some help.
Definitely. Support is a huge thing, and it's been shown in the literature too. I'm glad you've been able to get counseling services as well. So what makes head and neck cancer different from other cancers and from a patient perspective?
Well, this cancer is very ugly. It's very depressing. It's demoralizing, disfiguring, and there's a constant reminder. But more importantly, it sucks the life out of you. It sucks the life out of you in such a way that I was a foodie person. I like to eat. But when you have a peg, you can't eat. It takes the life out of the person wanting to live. And if you let it take over you, you never make it out. So somewhere it needs to change through support groups in the family to get you back on the healing time. Otherwise, you will never recover from this surgery.
What advice would you give to other patients who are going through something similar?
Seek help. Ask for help. It's okay to get help. If you're a man, woman, child, it's okay. Men are grown up in this country where you can't cry, you can't talk to anybody about these things. Suck it up and work through it. And that's what gets us in trouble. It got me in trouble. So it took me a long time to admit. And receive the help. But if it wasn't for my wife and kids, so I wouldn't be here. If it wasn't for them to force me to seek counseling, I don't think I would have gone through this next 5 surgeries.
Your story is inspiring and will continue to live on. What sort of gives you that courage every day to keep fighting?
As I look around, I have many nights that I don't sleep, so I have these visions. And in all those visions, I feel like I'm running. Somebody's trying to come and get me, and I realize that it's me who's chasing myself. It's trying to stop me and listen and just smell the roses for a minute. It could be a lot worse. And I've seen a lot worse. I feel like I don't have it that bad. I'm here with you and all of you. But we forget that because we get caught up in the minutiae of selfishness. And I try not to go there all the time. But it takes me there sometimes, the pain and the word cancer. So it's a constant battle. But I try to think the positives of it. And I know I'm going to get out of it one day with the help of my team of doctors. And I know I'm not ready to die yet.
Definitely. I know that you started a nonprofit organization called LK Foundation. What inspired you to do that, and what's your mission or goal for the organization?
LK was founded on the premise of helping others see the light before they go wrong. From day one, when they find out cancer, counseling needs to start. I didn't realize that until after. And I think you can save the person a lot of pain and grief if you can help them through that. And so I'm hoping to find some help research and develop techniques for the head and neck cancer, as well as counseling, suicide awareness. Because I think a lot of men who have cancer could use a lot of counseling. Not that women can't. The women will go seek it. Men won't. So I'm hoping that the foundation can help bridge that gap that we have.
Definitely. I'm really glad you created that as hopefully an avenue for all of this to happen. It's something that's definitely needed. It's really inspiring. And I just want to thank you again for your time and for sharing your story with all of us.